Gynecomastia is an accumulation of fat and breast tissue in the male breast. Gynecomastia many times can come about as early as puberty. Now, fortunately, most of the cases that come about in puberty, they go away on their own. So generally, we don't address these as surgeons. Gynecomastia, once you've come out of puberty, if it hasn't gone away on its own, now becomes a cosmetic issue. It can destroy a kid's self-esteem and confidence. And I can tell you this personally because I had it when I was an adolescent. How do we diagnose gynecomastia? The diagnosis of gynecomastia is actually clinical, means it's just based on physical exam. So I examine the male. If the chest is enlarged, by examining it, I can tell if it's more of a fattier accumulation or more of a breast tissue accumulation. So gynecomastia can be caused either by an excess of breast tissue, or commonly, the breast tissue that is naturally in the male breast is more sensitive. The receptors in that tissue are more sensitive to estrogen that we have floating around in our bloodstream. And guys, believe it or not, we do have estrogen floating around in our bloodstream, just like women also have some testosterone floating around in theirs. So when that tissue is more sensitive to our natural estrogen, it can become enlarged. It's important to note the difference between fatty gynecomastia and glandular gynecomastia because it is important for the surgeon to remove the entire glandular tissue. Otherwise, the chances of it coming back are high. Gynecomastia of the glandular type historically has been treated through a semilunar incision on the lower border of the areola. A surgeon would make that sort of half-moon crescent incision and carve out all of that breast tissue. The problem with that operation is that many times the surgeon would remove too much breast tissue and it would create what we call the saucer deformity, basically a depression behind the areola that was very unsightly and also very difficult to treat. Liposuction of the chest allows removal not just of the gynecomastia, but it allows contouring of the entire pec region. The technique I use in gynecomastia depends on what percentage of the gynecomastia is fatty and what percentage is glandular. So typically, I will infiltrate the entire pec region with numbing fluid. I use an ultrasonic probe to break up the hard, firm, dense glandular tissue. And this is very important because glandular male breast tissue is actually very hard. Generally, regular liposuction, what we call suction-assisted liposuction, is not powerful enough to break that tissue, so you can't suction it out. By using an ultrasonic probe, we fracture it into very small little fragments, which then I can liposuction out with my standard liposuction. Once I've liposuctioned the entire pec region, I examine the chest and I can determine if there's any residual glandular tissue left, and generally there is. So I have a special instrument that I use to remove that glandular tissue through the same incision as the liposuction. And this is really important because you don't only want to improve the contour of the pec, you want to also avoid any stigma, any marks that the patient has had surgery. And by doing it through a liposuction incision, it's a 4mm incision that's hidden in the crease of the pec, and it is virtually imperceptible once it has healed. There's basically 4 steps in the operation. Step 1 is infiltrating fluid that has numbing medicine and medicine to minimize bleeding and bruising. Step 2 is using an ultrasonic probe to break up the hard, dense glandular tissue into small fragments so that we can then approach step 3, where we suction the entire chest, suction and contour. And step 4 is the final step, is removing any residual glandular tissue through direct extraction. And this is done through the same incision as the liposuction. So I can do this through a 4mm incision hidden in the crease of the breast. The operation usually lasts about an hour to an hour and a half, depending on how much breast tissue there is and how firm, how dense that breast tissue is. It can be done either local anesthesia or general anesthesia, depending on the patient's desires. The recovery is very quick. Most of my patients can go back to work and drive in about 3 or 4 days. I let people go back to the gym at 2 weeks, starting out with cardio and lower body, and by 4 weeks they can be up to completely their old routine. During those first 4 weeks, I do recommend several massages to help with fluid and swelling, and you will be in a compression garment, which helps with the swelling as well. There are 3 levels of gynecomastia: level 1, 2, and 3. Level 1 is mild gynecomastia. It's a mild accumulation of breast tissue and fat. Level 2 is a higher level of fat and breast tissue, and there's actually a 2A and a 2B. And the difference is if there's extra skin. If there is extra skin, then it is a 2B. And 3 is essentially a female appearing breast that is droopy, it's large, and it has a lot of breast tissue. The approaches of treatment are different depending on the level of gynecomastia. Liposuction and glandular tissue removal is an excellent choice for stage 1 and stage 2A gynecomastia. Stage 2B sometimes can be improved through liposuction, glandular removal, and the addition of J-plasma. J-plasma is a skin tightening procedure that shrinks down the skin envelope, giving a better contour. Stage 3, which is a female appearing breast, many times will actually have to be performed a male breast reduction. This is when we actually remove the breast tissue and the extra skin. So this is a larger operation that will have a scar that goes in the crease of the breast and a circular incision around the areola. But most patients that come in for gynecomastia do very well, have excellent results with liposuction and glandular removal. However, there is a healing process. The results of gynecomastia surgery are dramatic. Usually the final result is seen between 6 and 12 months. It's important during that time to always use sunblock. Procedures that create a lot of inflammation close to the skin, such as liposuction, specifically ultrasonic liposuction and J-plasma, can activate the pigment cells in our skin. So receiving sun can cause them to become hyperpigmented, where you can get dark spots. So it's very important to protect yourself with sunblock during the healing process. One of the most common questions I get from patients regarding gynecomastia is, can it come back? And the answer is no. The only way gynecomastia comes back is if the glandular tissue was incompletely removed in the first operation. If the patient gains a lot of weight, fat can come back, fat can grow, which gives the appearance of gynecomastia. The key in gynecomastia surgery is complete removal of all glandular tissue. Gynecomastia is considered a cosmetic problem. As such, the best way to treat it is through glandular removal and contouring of the entire pec region. That's why it's exceedingly important not just to remove the glandular tissue behind the areola, but to contour the entire pec region, so that now, instead of having a bulging female appearing chest, we can turn that into a very masculine appearing pec. So the results of gynecomastia surgery are impressive from the day after surgery. I have patients that many years they have been embarrassed to take their shirt off, and the day after surgery they can't believe that their chest is flat. If you have any other questions about gynecomastia, if you want to know more, if you want to know any other details, go ahead and ask us in the comments and I'll be happy to answer them.